What makes Uganda stand out within the region and within the African continent at large?
So let me explain this to the population. First of all, we are in an area, people refer to it as the Congo Basin, but also our climate is quite good. It favors some of these outbreaks that occur from time to time. So when we got our first outbreak in the year 2000 of Ebola, that was in Gulu, Uganda was quite green about these outbreaks. But since then, we have built systems. And our systems, like I said, start from the grassroots. We were supported a lot in building these systems by the United States government through their Centers for Disease Control. Yeah. And we started with a pilot program. And the pilot was to address three things: whether we could set up very strong and proper laboratories and handle them within the country, whether we could have mechanisms of detecting these outbreaks, whether it is cholera or anything, in real time and reporting in real time, and whether we could have a response team that could respond in real time. So we piloted this, and the results of the pilot were extremely amazing. And from then on, we set out to build systems for detection. We put up a laboratory system that is spread all over the country, and we call them hubs. So these hubs report to central laboratories, which are at the regional hospitals or at health centers or at general hospitals. And we have lab riders that move all over the lower level health facilities and even into the communities to pick samples for analysis. That addressed the issue of the labs. Then the issue of the response. We set out to train epidemiologists, and we're looking at 200 epidemiologists per 100,000 population. We've made good progress with our FETP's Field Epidemiology Training Program that has been running now close to 10 years, since 2013. We train about 10 to 12 epidemiologists every 2 years. But we also have other programs that train for 3 months and so on to enhance the number of epidemiologists that we have in the country. And then we set out to strengthen the community system by training the people in the community, but also at the districts where we have surveillance focal persons. And then we set up the EOCs. Those are the emergency operation centers where we have dashboards. So my dashboards are not on, but if I could turn them on, I am able to view all the districts in Uganda at any one time and see what is happening there, and also follow up what is being reported. So if we have an outbreak of malaria, I can know which districts it is in. Whether it is measles, I can know which district it is happening in. If there is an unusual occurrence, I can easily detect that this is happening in Mubende. Samples have been taken somewhere, they are being analyzed just on my dashboards. That is our strength. So we are able to detect these outbreaks in real time, because time is of essence when you are responding to any outbreak. If it is Ebola and you allow time to pass, the contacts will have moved and you won't know where they have moved. Right now, as you saw in the last 2 outbreaks, we also brought in the aspects of quarantine to avoid them spreading out all over the country. Now, response to outbreaks is quite expensive, extremely expensive, and it is in millions of dollars. We have never handled any outbreak that has cost us less than 50 million US dollars and above. Usually it goes to 150 million, 200 million US dollars because of the various activities that we have to carry out. So our intention is to always ensure that we control these outbreaks as quickly as possible, to limit the expenditure, to avoid the spread, but most specifically, also adhere to the international health regulations and ensure that we don't allow it to escape from the country.
Yeah.
Now, you will notice that when we are handling all these outbreaks, the president is always part of it because of his voice that people listen to. It comes in very handy when he stresses the point and people listen. It makes our response to these epidemics quite easy. But also allow me to appreciate Ugandans. They have been our strength in handling these epidemics because when we talk to them and they listen, it makes our work also easy. We all watched what happened in Western Africa when people were not listening. But Ugandans listen and they adhere to the standard operating procedures. So allow me to appreciate Uganda.